The governor spent his final day of a statewide tour in place of this year's State of the State address in San Diego today. He announced a ballot initiative voters will see in 2024. It would help boost funding for mental health throughout the state. Governor Gavin Newsom described his vision at the Alvarado Hospital Medical Station near College area. That's where we find ABC 10 News reporter Natalie Chuck with more on his proposal. Hey, Natalie.
Hey there, Nia. Yeah, it was a packed house just through these doors behind me where the governor and other leaders from all across the state of California gathered in support of that ballot initiative. Now, if it passes, the bond would guarantee that at least $1 billion per year be dedicated towards behavioral health, housing, and care. And that is something the governor does believe will pass.
We have to address and come to grips with the reality of mental health in this state.
California Governor Gavin Newsom announcing plans to put the possibility of expanding housing for the mentally ill in the hands of voters.
It's unacceptable what we're dealing with at scale now in the state of California.
Passing a ballot initiative coming in 2024 would fill the shortage of 6,000 beds needed for behavioral health. A problem mental health advocate Anita Fisher knows all too well, sharing with a crowd that her son suffers severe mental health problems.
And because of the gaps and the holes in the system, he ended up homeless on the streets. He ended up in jail. He ended up in prison. And I would ask myself why.
It's all part of the governor's goal to, quote, modernize the state's Mental Health Services Act by using the bond to bring in anywhere from $3 to $5 million and restructuring funds.
And so $1 billion a year, expanding the scope of what is included in terms of what was originally envisioned 20 years ago in the Mental Health Services Act.
He says it would prioritize caring for people like homeless veterans, people with substance use problems, or who are severely mentally ill.
We're fooling ourselves that if we don't address that fundamental need, that we can turn this thing around.
It's a mission he believes the people of California,
we're going to win this thing,
will support.
Come November 2024.
Now, when he was asked how exactly the money will be restructured within the Mental Health Services Act, he said that they will work with the counties and cities to figure that out. And from the hospital, the governor headed down to the border to discuss fentanyl and overdoses within the state. We are waiting on word from his office for more details about that. For now, reporting from the Alvarado Hospital, Natalie Chuck, ABC 10 News.